I got interested in this study because, for a couple reasons. One is because of my strong interest in drugs and how we use medicines and how to use them better. And I'm interested specifically, especially because I'm a pediatrician, in how we use antibiotics specifically, because it's such an important issue in our country right now and even worldwide. Bacterial organisms are becoming increasingly resistant to antibiotics, and it's happening faster than we can develop new antibiotics to treat them. And the more we use antibiotics, the faster the bacteria get resistant to them. So it's really a public health crisis. And if we can decrease unnecessary antibiotic use, we can save antibiotics as long as possible for when they're needed. The findings of our study were really two main areas. First of all, we found that it's reassuring that we don't need to use antibiotics for people with common colds. We know that common colds are usually caused by viruses, and the viruses don't respond to antibiotics. But despite this, about half the time, the doctor in the United States prescribes an antibiotic for a common cold. And we think this is probably because people are worried that the cold's going to progress into a more serious bacterial illness. And we found from our study that common colds, while doctors prescribed antibiotics for a little over half the common colds, these were very, very unlikely to progress into a more serious bacterial infection. And this is reassuring that it's safe to not use antibiotics for these illnesses. The other part of this study was that we looked at adverse events or side effects that happen after an antibiotic is used. Many times if something bad happens after a drug is used, people attribute that to the antibiotic. They say it's a causal relationship. And what we wanted to get a better idea of exactly what the risks were of prescribing antibiotics, exactly what the risks were of serious side effects. And we found that we compared similar patients with common colds who received antibiotics and who didn't receive antibiotics. And we found that there was no increased risk of these bad side effects that we were looking for. So we think a lot of the time, or at least some of the time, that a bad side effect is attributed to an antibiotic. Some of that might be related to the patient's underlying condition, or maybe that bad thing would have happened whether or not the patient received the antibiotic. We were somewhat surprised with the first result that we need to treat so many patients in order to avoid one hospital admission for pneumonia, for example. And we thought it would even be fewer than that. We were surprised at how little antibiotics really helped. We thought there would be even a little bit of a greater risk for the common cold to progress into a bacterial infection. And then really the risk was much smaller than we thought. The other thing is, I think we thought there would be a small risk of these adverse events or these drug side effects after the antibiotics were used, but with millions of office visits, we weren't able to show that there was an increased risk of these bad side effects. And I guess we were surprised about that too. It reinforces that we need to be careful when we think that something's caused by something. We need to look and see maybe there's another thing that can explain it. It's taken a long time for research to have made influence on antibiotic prescribing, but because of publication of studies like mine and because of public health campaigns, our antibiotic prescribing, our unnecessary antibiotic prescribing has decreased in the United States, but it could still stand to decrease a lot more. Certainly, I think people should prescribe antibiotics when they're indicated and when they can be helpful. But I think we can do a lot more to decrease our unnecessary use. And I think that I don't think it's going to happen overnight. I think it's going to be a gradual process. And I think it's not just my study that's going to make a difference. It's collectively all the scientists who are working on this, and the public health officials who are working on this, and patients who need antibiotics to be effective in the future, and physicians and who want to be able to prescribe these in the future. I think it'll be a gradual process that we'll all work together to hopefully continue to improve things. I think we can take a two-pronged approach. One, I think this study and other studies are reassuring that it's safe to not prescribe antibiotics for these infections, the common colds that are almost always viral. And I think patients and medical caregivers are increasingly recognizing that. Number two, I think that there's things that we can do to prevent these illnesses to begin with. For example, people could get the influenza vaccine, and that'll prevent one kind of viral illness. So I think that there are things that we're gradually learning that will help with our antibiotic needs and our antibiotic decision making. I think the result of this study can really help decision making about antibiotic use. I think it'll reassure us that it's safe to not use antibiotics for these common colds, which are almost always caused by viruses which don't respond to antibiotics. And I think that it'll help make people more comfortable with that. And then again, we can it'll help us make our use of antibiotics more judicious and help preserve antibiotics benefits for the future.